We've all been there, ladies. That unbearable itch that makes you want to scratch like a maniac. Yep, we're talking about vaginal itching. It's uncomfortable, it's annoying, and it can make you feel like you're the only one in the world dealing with it. But trust me, you're not alone. Vaginal itching is incredibly common. It's one of those things that most women experience at some point in their lives. So, let's ditch the embarrassment and talk about it openly, shall we? This isn't just about scratching an itch. It's about understanding your body and taking control of your vaginal health. After all, a happy vagina is a happy you. So, are you ready to dive into the world of vaginal itching? Let's get started. Visit our website for more information and resources on vaginal health. Okay, let's cut to the chase. Vaginal itching is usually a sign that something is off balance down there. Think of it as your vagina's way of getting your attention. It's like that little red light on your car dashboard. It's telling you something needs to be checked out. Now, before you start Googling every possible cause and freaking yourself out, we've all been there. Let's break it down. Vaginal itching can be caused by a whole bunch of things, from simple irritations to infections. But don't worry, we'll get to the bottom of it. In the next few sections, we'll explore some of the most common culprits behind that pesky itch, and, more importantly, what you can do about it. So, grab a cuppa, get comfy, and let's get real about vaginal itching. When it comes to vaginal itching, many women immediately think of yeast infections. Yeast infections are often the first thing that comes to mind. And for good reason. They're incredibly common and can be quite uncomfortable. In fact, most women will experience at least one yeast infection in their lifetime. It's almost like a rite of passage that no one wants. So what exactly is a yeast infection? It's a common question with a straightforward answer. Well, it's basically an overgrowth of a type of fungus called Candida. This fungus is naturally present in the vagina. Normally, Candida coexists peacefully with other microorganisms, but sometimes things get out of whack and it multiplies like crazy, leading to the dreaded itching, burning, and discharge. These symptoms can be quite distressing and disruptive to daily life. Yeast infections can be triggered by a number of things, like antibiotics, hormonal changes, yellow period, and even stress. Antibiotics can disrupt the natural balance of bacteria in the vagina, while hormonal fluctuations during your menstrual cycle can create an environment where Candida thrives. The good news is that they're usually pretty easy to treat with over-the-counter antifungal creams or suppositories. These treatments are effective and can provide relief within a few days. But here's the catch. Not all vaginal itching is caused by yeast infections. There are other conditions that can cause similar symptoms. So if you're experiencing persistent or recurring itching, it's important to consider other possibilities. It's always best to check in with your doctor to rule out any other underlying conditions. Your health and peace of mind are worth it. Alright, so we've covered yeast infections. But what about those times when the itch just won't quit, even after a course of antifungals? It can be incredibly frustrating and worrisome when you think you've tackled the problem, only to find that the itching persists. You might start to wonder if there's something more serious going on, or if you're missing a crucial piece of the puzzle. Well, there are a few other sneaky culprits that could be causing your discomfort. These culprits can often be overlooked or mistaken for something else, leading to prolonged discomfort and confusion. One common offender is bacterial vaginosis, BV. BV is a condition that many women experience at some point in their lives, and it can be quite persistent if not properly treated. Don't let the fancy name scare you. It's basically just an imbalance of bacteria in the vagina. This imbalance can lead to a variety of symptoms that are often mistaken for other conditions. Unlike yeast infections, BV usually comes with a fishy odor, and you might notice a thin, grayish discharge. These symptoms can be quite distinctive, making it easier to identify BV if you know what to look for. Then there are the usual suspects, like irritants. Everyday products that you might not think twice about can actually be the source of your discomfort. Soaps, detergents, douches, even certain types of toilet paper can irritate the delicate skin down there, leading to itching and discomfort. It's important to be mindful of the products you use and how they might be affecting your body. And let's not forget about sexually transmitted infections, STIs. STIs are another potential cause of persistent itching that should not be overlooked. Some STIs, like chlamydia and trichomoniasis, can cause vaginal itching, along with other symptoms like discharge and pain during sex. These infections require medical treatment, so it's crucial to get a proper diagnosis. The bottom line is, if you're experiencing persistent vaginal itching, it's always best to err on the side of caution and get checked out by a healthcare professional. They can help you determine the exact cause of your symptoms and recommend the appropriate treatment. Remember, your health and comfort are worth the effort. Don't forget to subscribe to our channel for more health tips. Section 5. Taming the itch. Remedies that actually work. Okay, enough with the doom and gloom. Let's talk about how to actually get rid of that pesky vaginal itching. It can be incredibly frustrating and uncomfortable, but the good news is that there are effective solutions out there. Whether you're dealing with a yeast infection, bacterial vaginosis, or just general irritation, there are remedies that can help you find relief and get back to feeling like yourself again. The good news is that there are plenty of remedies that can provide relief, both over-the-counter and home remedies. Over-the-counter options are often the first line of defense and can be found at your local pharmacy. These include antifungal, creams, suppositories, and other medications specifically designed to target the root cause of the itching. For yeast infections, over-the-counter antifungal creams or suppositories are your best bet. These products are designed to eliminate the yeast causing the infection and can provide relief relatively quickly. It's important to follow the instructions on the packaging to ensure the treatment is effective. They usually clear up the infection within a few days. However, if your symptoms persist or worsen, it's crucial to consult with a healthcare professional. Sometimes, a more potent prescription medication may be necessary to fully eradicate the infection. If you're prone to yeast infections, your doctor might recommend a longer course of treatment or even preventative measures. This could include taking antifungal medication on a regular basis or making lifestyle changes to reduce your risk of future infections. For BV, your doctor will likely prescribe antibiotics. These medications are effective at targeting the bacteria causing the infection and can help restore the natural balance of bacteria in your vagina. In the meantime, you can try applying a cool compress to the affected area to soothe the itching. This can provide temporary relief and help reduce inflammation and discomfort. And when it comes to irritation, prevention is key. Identifying and avoiding potential irritants can make a big difference in preventing future episodes of itching and discomfort. Switch to unscented soaps and detergents. Avoid douching. Your vagina is self-cleaning. And opt for soft, white toilet paper. These small changes can help maintain the natural balance of your vaginal environment and prevent irritation. Remember, every woman is different, so what works for one person might not work for another. It's important to listen to your body and find the remedies that work best for you. Don't be afraid to experiment with different treatments and consult with your healthcare provider for personalized advice. It's all about finding what brings you relief. With the right approach and a bit of patience, you can overcome vaginal itching and get back to living your life comfortably and confidently. Section 6. Your vagina, your rules. What works for you? Now I want to hear from you. Have you ever experienced vaginal itching? What remedies have you tried? What worked for you and what didn't? Let's get a conversation going in the comments section below. Share your experiences, your tips, and your questions. Let's create a safe space where we can learn from each other and break the taboo surrounding vaginal health. I'll give you a few seconds to gather your thoughts and type out your comments. Don't be shy, ladies. Your voice matters. Section 7. Menopause and vaginal health. A whole new ballgame. As we age, our bodies go through a lot of changes, and our vaginas are no exception. During menopause, declining estrogen levels can lead to vaginal dryness, thinning of the vaginal walls, and yes, you guessed it, itching. These changes can make the vagina more susceptible to irritation and infections. But don't fret, there are ways to manage these changes and maintain vaginal health during menopause. Using a good quality vaginal moisturizer can help combat dryness, while vaginal estrogen therapy can help restore the vaginal tissues. The key is to listen to your body and talk to your doctor about any concerns you might have. Remember, age is just a number, and you deserve to feel your best at every stage of life. Section 8. Take charge of your vaginal health today. So, there you have it, ladies. We've covered the ins and outs of vaginal itching, from the common causes to effective remedies. But the most important takeaway is this: don't suffer in silence. Vaginal itching is incredibly common, and there's absolutely no shame in talking about it. In fact, talking about it openly is the first step towards breaking the stigma and empowering ourselves to take control of our vaginal health. So if you're experiencing persistent or concerning symptoms, don't hesitate to reach out to your healthcare provider. They're there to help you feel your best, both inside and out. Remember, a happy vagina is a happy you. Now go forth and conquer the world, one itch-free day at a time. Take charge of your health today. Visit our website and subscribe to our newsletter.